Hypoglycemia occurs when the blood glucose drops below 70 or drops below that patient's expected blood glucose range. It can occur very quickly, often within minutes. Causes include exercise, too little food, or too much diabetes medicine. Teach your patients the signs and symptoms of hypoglycemia. Mild to moderate symptoms include headache, blurred vision, hunger, complaints of feeling shaky or weak, being nervous or upset, being sweaty and clammy, and being lightheaded or confused. Severe signs include tachycardia, seizures, and lack of arousability. Tell patients that if they experience any of the signs and symptoms of hypoglycemia, they need to check their blood glucose immediately. If the patient is alert and able to swallow safely, they should be given 15 grams of simple carbohydrate. If the patient, for some reason, cannot check their blood glucose, they should still treat with 15 grams of carbohydrate. The following foods contain 15 grams of carbohydrate: 4 ounces of juice, 1/2 cup of regular soda, not diet, 4 glucose tablets, 5 to 6 little chewable candies. If the child is alert but groggy due to hypoglycemia, then 1 tube of glucose gel, which is equivalent to 15 grams of carbohydrate, can be smeared along the gums for rapid absorption of sugar. Advise patients on an insulin pump that they should stop their pump 20 to 30 minutes before treating with 15 grams of carbohydrate. After taking 15 grams of carbohydrate, the patient should wait 15 minutes to recheck their blood glucose. If the rechecked blood glucose is still less than 70, then the patient should retreat again with another 15 grams of carbohydrate and recheck the blood sugar again in another 15 minutes. This process should be repeated until the blood glucose is greater than 70. Once the patient's blood glucose is greater than 70, the patient should follow up with a snack. The snack is a mixture of carbohydrates and protein, such as a peanut butter sandwich, or milk and crackers, or a sandwich with lean meat. If the child is unconscious, seizing, or unable to safely swallow, instruct the parents to give glucagon immediately. Expect the child to awaken within 60 seconds, and if they do not, then the parent should call 911. Glucagon can cause vomiting, so the patient should be turned on their side to prevent aspiration. Now, if the child responds appropriately to the glucagon, the parents should then call their physician.